In this video, I'm going to be talking about breast cancer during pregnancy. The first thing I want to say is that this is so difficult. Pregnancy should be one of the happiest times of your life, and now you're dealing with breast cancer as well. We actually know a lot about how to treat breast cancer during pregnancy. To learn more about breast cancer during pregnancy, visit Yerbba.com. Breast cancer during pregnancy is tailored according to how far along you are in your pregnancy. The first thing you should know is that there is no need for you to end your pregnancy. We can manage both the breast cancer and your pregnancy together. Most people who have breast cancer during pregnancy are managed by a special type of obstetrician called a high-risk obstetrician or high-risk OB. If you haven't been referred to a high-risk OB, it is appropriate for you to ask to be referred to this kind of specialist. The obstetrician will work with your cancer care team to coordinate your care and to keep you and the developing pregnancy safe. Depending on where you are in your pregnancy, different tests might be done. We try to avoid ionizing radiation like that we use with CT scans in people who are pregnant. If you absolutely must have one of these scans, we do everything we can to avoid radiation to your reproductive organs. Chemotherapy in breast cancer is actually safe starting in the second trimester. Some people will have chemotherapy before surgery when they're pregnant to reduce the size of the tumor, reduce any disease in the lymph nodes, and allow the baby to mature before having surgery. There are a couple reasons to do this that I won't go into in detail. But if you're offered chemotherapy before surgery, know that this is safe as long as you're in the second trimester. If you don't know how far along you are, your obstetrician will help you figure that out through ultrasound. Surgery is generally safe during pregnancy. We try to minimize the amount of time that you're under anesthesia. So chemotherapy before surgery can actually help improve the amount of time you're under anesthesia by decreasing the complexity of the operation. Radiation therapy is not safe during pregnancy, so we don't give it at any time during pregnancy to a developing fetus. Let's say you're in your third trimester and you're close to delivering your baby. If we can, we will wait till the baby's born to start treatment. That's not always safe. If you have a more active breast cancer, or you might hear the word aggressive breast cancer, we will start treatment first while you're still pregnant. Under the care of your specialized obstetrician, you may decide, with your doctor's advice, to have the baby on the early side when it's still safe for the baby, but it will help speed up the time to starting treatment for breast cancer. This is highly personalized, as you can tell. What we want you to know is that we know how to treat breast cancer during pregnancy. We keep your health and the baby's health top of mind. Working with a pretty specialized team will help you get through this. I wish you weren't going through this, but I do hope the video has been helpful. Visit Yerbba.com to learn about your special situation. If this video has been helpful to you, click like and subscribe so other people just like you can find this information.